This is a review about the DDS 300 back decompression brace. I'm going to explain what makes this back brace a little bit different from other back braces, what types of problems it may be good for, and then I'm going to open up the box, show you how you put it on, how you use it, and help you figure out if this is something that may be beneficial to you. So first of all, what makes this type of back brace a little bit different from a normal back brace? Well, normal back braces, they just squeeze around you that way. And that's good if you have some spinal instability or things like that. But it doesn't take into account a big problem in back pain. And many types of back pain, particularly things like spinal stenosis or degenerative disc disease, sciatica, bulging or herniated discs, they're sensitive to gravity, or they're sensitive to the compression from gravity, where gravity is always pushing down on you towards the center of the earth, and it's compressing the joints and the discs in your spine together. And that can put pressure on the joints in your spine. It can compress on nerve roots and cause sciatica or pain going down your legs. And normal back braces that just squeeze like that, they don't account for that downward force because they're just pressing inwards. So that's what makes this brace a little bit different, is that it has some air columns in it, and I'll show you those in a moment, where they inflate and they actually kind of lift you up. So let's open up the box here and see what all is inside. So it comes with a brace like this, and you'll see it has some little air columns here. From the outside you can see them, and from the inside, and each one of these is a little hollow column that when you put it around and you pump the brace up, it actually inflates with air. It also comes with a pump to help inflate the device. So I'm going to put it on here and show you how you use it. So you put it on like this. You put it around your waist, above your pelvis and below your rib cage ideally. It is pretty slim, so it's easy to get it in that area. You want to fasten it kind of tight, just to a comfortable degree of tightness, so it won't slip or slide. You want to make sure that the air valve is pointing upwards. Now you're going to take this clip and you're going to attach it to the air valve here, and just clip it on like that, and you start to pump it up. And as you pump, you can see that the gauge, the pressure gauge here, starts to go upwards, and you can feel the brace, it starts to lift. Those little air columns, they start to inflate. You want to pump it up till it's in this green range right here. That's the optimal range. So it's giving you some lift, but it's not overinflating the brace, and the brace is going to last for a long time if you don't overinflate it. So then once you have it inflated, you can take it off, and this air valve, it just holds the air in there. And then you can walk around and you can do things that you enjoy doing, walking, doing household chores, working if you have an active job. Whatever you like to do, you can do that, and it takes that gravitational compression off. It helps lift you up. And it's very much like a treatment called traction that you may have in physical therapy, or some chiropractors refer to it as decompression therapy. And essentially, that's where you lay on a table and it stretches you out like one of those medieval torture racks. But that's very helpful while you're laying down. But the big problem is once you stand up and gravity starts compressing down on you again, all that effect goes away. But that's the nice part about this type of brace, is that you can walk around with that traction effect, or that decompression effect, and it helps give you some relief while you're doing your everyday activities. Now, is it going to completely solve your problems? No, it's not, but it is a helpful tool that if you do have a gravity-sensitive condition like spinal stenosis, degenerative disc disease, sciatica, herniated discs, where you feel worse when you're up standing and walking, and you feel better when you're laying down, where when you're up standing, gravity is pressing down on you, and when you're laying down, gravity is going this way while your body's going that way, and so it's not pressing down on you. That's a good indication that you might have a gravity-sensitive problem that could benefit from something like this. Now, again, you're probably going to want to do some physical therapy, and if you are in St. Louis, I do own a physical therapy clinic in St. Louis, and we'd be happy to help you find the root cause of your problem. But if you're just looking for something to give you a little bit of relief right now, to be able to go around and do your normal everyday activities without your back hurting quite so much, this DDS belt is a good solution. And I will put a link down below along with a discount code that you can use to save a little bit of money if you would like to buy a belt somewhat like this. Now, what do you do when you want to take it off? Well, you just stand up and you take this little valve and you twist it. And you can hear it starts to let the air out. The brace will deflate. And then you just take the Velcro off. And it also comes with a storage bag if you want to take it with you while you're traveling or something like that. That's included in the box as well. So again, that's the DDS 300 belt. I hope you found this video helpful. If you did, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So thank you so much for taking the time to watch today, and enjoy the rest of your day.